Good morning, all. Am I audible? Hello. Am I audible to all? Yeah, great. Good morning. We are starting with the player.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master Samuel Hahnemann, who has given us this divine tool and science to all of us and taught us dare to be wise. With the blessings of our Guru, Dr. Prafull Vijayakar, Sir has connected this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakaya Namah. So friends, we are in the journey of reading the aphorism from the Organum of Medicines by Samuel Hahnemann, 6th edition, and also we are in the journey of the reading the book, The End of My Assumptions of Miasm. So we will continue our journey. So up till now we have learned about the 67 aphorism and the antibiotic mode of treatment. Now what about the homeopathic cures? In homeopathic cures, they shows us that from the uncommonly small doses of medicines required in this method of treatment, which are just sufficient by the similarity of their symptoms to overpower and remove from the sensations of the life principle and similar natural disease, there certainly remains after the destructions of the latter. At first, a certain amount of the medicinal disease alone in the organism, but on account of the extraordinary minuteness of the doses, it is so transient, so slight, and disappears so rapidly of its own accord that the vital force has no need to employ against this small artificial derangement of his health any more considerable reactions than will suffice to elevate its present state of health up to the healthy point. This is then will suffice to effect complete recovery for which after the extinctions of the previous morbid derangement but little effort is required. This is what modus operandi of homeopathic medicines is. In aphorism number 69, what Master is said that in the antipathic mode of treatment, however, precisely the reverse of this takes place. That means reverse of homeopathy has been takes place. The medicinal symptoms which the physician opposes to the disease symptoms, for example, the insensibility and stupefactions caused by opium in its primary action to acute pain, is certainly not alien, not wholly antipathic to the latter later with the disease. There is a manifest relations of the medicinal symptoms to the disease symptoms, but it is the reverse of what should be. It is here intended that the annihilations of the disease symptoms should be effected by an opposite medicinal symptoms, which is nevertheless impossible. No doubt, the antipathically chosen medicine touches precisely the same disease point in the organism as the homeopathic medicine chosen on account of the similar affection. So the target of the both remedy are the same, but the former covers but lightly the opposite symptoms of the disease only as opposite means the antipathic model and makes it unobservable to our life principle for the short time only so that in the first period of actions of the antagonistic palliative the vital force perceive nothing disagreeable from either of two, neither from the disease symptom nor from the medicinal symptom, as this seems both to have mutually removed and dynamically neutralized one another as it were. For example, the stupefying power of opium does this to the pain. In the first minute, what happens when the allopathic employment or antipathic employment is done? In the first minute, the vital force feels quite well and perceive neither the stupefactions of the opium nor the pain of the disease. But as the antagonistic medicinal symptoms cannot occupy the place of the morbid derangement present in the organism in the sensations of the life principle as a similar, means like a homeopathic, stronger disease, and cannot therefore, like a homeopathic medicines, affect the vital force with a similar artificial disease, so as to be able to step into the place of original natural morbid derangement. The palliative medicine must as things totally different from and the opposite of the disease derangement leave the latter means the disease uneradicated it render it, as before said by the semblance of the dynamic neutralizations, at first unfelt by the vital force, but like every medicinal disease, it is soon spontaneously extinguished and not only leaves the disease behind, just as it was, but compel the vital force to produce an opposite condition to this palliative medicines, and the reverse of medicinal actions, consequently the analogues of the still present undestroy natural morbid derangement, which is necessarily strengthened and increased by these additions. The reactions against the palliative produced by the vital force. So what Master is telling in this said, whenever any employment of the antagonistic medicine happen, in initial state it seems like that vital force perceives that everything is fine. But due to the law of opposite, it cannot cure and it cannot overcome the dynamic disease. So dynamic disease remains static there, and then it worsen in the antibiotic mode of treatment. Now what happens? The disease symptoms. This single part of the disease consequently become worse after the term of actions of the palliative has expired. So disease symptoms has worse. Worse in proportion to the magnitude of the doses of palliative. So in initial stage, the painkiller was given, the pain is subsided for a time. Again, the painkiller is increasing the dose of painkiller. Mostly it happens in the cases of cancer when there is a pain of the cancer is there. So they prescribe a painkiller, tramadol, initially paracetamol, then tramadol, then tramadol does not work. Then they go into the doses of giving a morphine. So this is what something initially it subside for a time being. When the effect of that medicine is gone, it works to the proportionate. Accordingly, keep the same example, the larger doses of opium given to allay the pain, that is a morphine. So much the more doses the pain increase beyond its original intensity as soon as the opium has exhausted its action. So this is what Master is telling us. So in footnote number what Master is telling us that in the living human being no permanent neutralizations of contrary or antagonistic sensation can take place. So only take place is the similar or similia is there. No contrary sensation has been take place for the neutralization, as happen with the substance of opposite quality in the chemical laboratory. For instance, sulfuric acid and potash unite to form a perfectly different substance, a neutral salt, which is now no longer either acid or alkali and is not decomposed even by the heat. Such amalgamations and through combinations to form something permanently neutral and indifferent do not, as has been said, ever take place with respect to the dynamic impressions of an antagonistic nature in our scientific apparatus. Only a semblance of neutralizations and a mutual removal occur in such cases at first, but the antagonistic sensation do not permanently remove one another. So it cannot remove. For example, the tear of the mourner will be dried for but a short time by a laughable play or a joke, or however soon forgotten this, and his tear then flows still more abundantly than before. So this is what the master is telling us. Plain as this a proposition is, it is has been misunderstood, and in the opposition to it, some have asserted that the palliative in its secondary actions, which would be then similar to the disease present, must be capable of curing just as well as the homeopathic medicine doses by its primary actions. But they did not reflect that secondary actions is not a product of medicine. Second reaction is not the product of medicine. Second reaction is the product of the vital force reaction, but invariably of the antagonistically acting vital force of a organism. That therefore this second reactions resulting from the vital force on the employment of the palliative is a state similar to the symptoms of disease, which is palliative left uneradicated, and which the reactions of the vital force against the palliative consequently increase still more. So palliative mode of treatment is no longer helpful in treating the disease. As also is given in footnote number 70, as when in the dark dungeon where the prisoner could with difficulty recognize object close to him. So alcohol is suddenly lighted. Everything is instantly illuminated in most consolatory manner to the unhappy wretch. But when it is extinguished, the brighter the flame was previously, the blacker is the night which now envelop him, and render everything about him much more difficult to be seen than before. So these are the few logical examples given by Master to all of us. So this is what the wisdom word of our master to understand the homeopathic employment of the medicines and the antipathic difference between the antipathic employment of the medicines and its actions. Now we are in the journey of reading the book, the end of my assumptions of miasm. So as we have learned everything from this book, So we understood that the miasm is the defense mechanisms of our genetic apparatus, and this defense mechanism is represented into three process called as the physiological process and the morphological process. The morphological process divided into two processes: the morphological constructive process and morphological destructive process. So physiological process represent the sora, the morphological constructive represent a psychosis, and the morphological destructive process represent the syphilis. In this book, we have read about the pathophysiology about a certain disease, that the disease is produced in the form of physiological defense as an inflammatory primary response. So that is all ITs are there in the sora. In second phase, we have learned about when the sacrificing of the functions of the reproduction giving rise to the excess reproduction or the less reproduction at the cellular mechanism, which gives rise to either a psychosis excess or psychosis less, and which is represented in terms of accumulations, depositions, synthesis, and the proliferations at the level of cellular mechanism, and there are many different diseases associated with it. Then we have learned about the process of total destructions of the cellular mechanism to save the whole. So in that we have two process called as a necrosis and the apoptosis or apolysis. So in necrosis it is a destruction of the particular part. In apolysis, that is what the program cell does, and both are in represent at the level of destruction at the level of cellular mechanism. Then we enter into the mind of the cell. So how the mind is represented into this as a defense mechanism. So in Sora, it is the conscientiousness, diligence, anxiety, apprehensions, and everything. Whereas psychosis, the base of psychosis is based on the fear and cowardice. So in return, they have a projections, and in return, they have a hiding or escape mode in the psychosis excess or psychosis less, respectively. And in the third point of the mental process of the syphilitic destructive process, so it may lead to either a distortions, perversion, or a destruction at the level of will, intellect, moral, and sensitivity. So that is what we have learned up till now. Then after we have understood that the how to understand the man, so the man, for the man we have to understand the history, and out of that history we can get a certain rubric. So in the last session we have understood that certain rubrics are there in the soric phase, certain rubric are there in the psychotic phase, and certain rubric are the syphilitic phase. So out of that we have to understand the each and every remedy which is in the tri-miasmatic mode of presentation. So sulfur can be a trimiasmatic sulfur. Most of polycrest remedy are there in the trimiasmatic mode. So we have understood up till now these things. So today we are dealing with the disease part and how the disease reflections at the level of miasm. So there are a different diseases which represent at a particular level and which is forming a miasm at particular levels. So, the miasmatic reflections of the disease. So from the base up till now, we have understood the theory of separations in the previous session. So, in the theory of separation, we have made a chart that layer one, 2, 3, 4, 5, 6. So, from layer 1, we are dividing the disease into the three miasmatic categories: psora, psychosis, and syphilis. So, at the level of skin, how the psoric symptoms represent as the acute eczema, a small boils, acne, a rash, a scabi, all are the psoric skin conditions. When this goes into the chronic process called as a chronic inflammatory eczema, the chronic eczema with the blackish discolorations, the lichenifications, the viral infections like the warts, proliferations, the fungal infections, the accumulative disorders like a lipoma, fibroma beneath the skin, xanthoma beneath the skin, all are psychotic in variant. Whereas there is a deep crack, fissures, bleeding, carbuncles with the multiple openings, and varicose ulcers and malignant CS, all are syphilitic in nature. So you have to categorize each disease with the layer. Rheumatic arthritis. There is a difference between rheumatic arthritis and rheumatoid arthritis. So initially the arthritis starting with the pain in the joint. So only the inflammatory process is happening. Most probably it happens after some of the viral infections or after the urinary tract infections. It is called as a reactive arthritis. So when there is a reactive arthritis, only the CRP is raised. The inflammations, particularly in the joints. So this is a psoric in nature. When this inflammation goes with the swelling of the particular joints, the proliferation of the synovial membrane, there is a formation of the osteophyte at the level of the joint, or the accumulation of the synovial fluid into the joints. These are called as a psychotic arthritis. And when the destructions of the cartilage has been started, the bone started, or cartilage and bone has been started due to continuous frictions and the aging process. These are called as the syphilitic arthritis. Rheumatoid arthritis. So rheumatoid arthritis is a variant where it is started with the process called as autoimmune disease, and it is a self-destruction. So this is what rheumatoid arthritis is, syphilitic in nature. Now, osteoarthritis initially present with the primary inflammatory symptoms. They are being suppressed with the help of some of the medications of the painkiller. Then it goes into development of the psychosis, that is the chondrocytes proliferation has been taken place. And later, in a later state, there is a development of the progressive erosions of the articular cartilage take place, and that is leading to the syphilitic osteoarthritis. The another arthritis which we call as a gout. Gout is because of accumulations of the or depositions of the crystals of the urate. So this is what the psychosis in nature. But the presentations of the acute gout is psychosyphilitic or sometimes a pseudo-psychotic. So this is what you have to understand. What to target into the case. Ankylosing spondylitis. The ankylosing spondylitis is the disease of the spinal cord, so in which there is a destruction due to the autoantibody present in the body. This is syphilitic in nature. HLA-B27 is positive, ankylosing spondylitis. It shows it is just an inflammation, but it is something called the syphilitic inflammation. Then we have a SLE. SLE is also due to the presence of the autoimmune system, autoantibodies in the body, and it produce a destructions at the level of particular part, and distortion take place. So it may affect the multiple system. Systemic means that it may affect the multiple system. It may affect the connective tissue. It may affect the skin. It may affect the blood vessels. It may affect the heart. It may affect the multiple organs. So this is what you have to understand, which are the system is involved into patient at the autoimmune level. These are the syphilitic in nature. Now, if we have a patient with the low HB and anemia, we need to find out the cause behind that. And if it is the cause is a nutritional deficiency due to the diet related, the patient is not taking any diet, and then he develops this, then it is purely a psoric in nature. But if it is because of there is a less productions of the hemoglobins or a hypoplasia or a depressions of the bone marrow, then it is called as a psychosis less, or it is mostly a psychosis. And when there is a destructions of the particular RBCs, it may be due to the pernicious anemia or a destructive disease of the blood, then it is called as a syphilitic anemia. For more understanding on anemia, you can go to the medicines book and you can understand that the basic pathophysiology behind the anemia. Then and then you can encounter that which anemia to be put into which categories. Okay. The another variant is called as a thrombocytopenia. So in thrombocytopenia means the destructions of the neutrophils or the leukophils. So both are the destructions. So this is what a thrombocyte means. That is leukopenia and neutropenia. So that is what we have to understand, that everything is thrombocytopenia, leukopenia, and neutropenia. Everything is going into destruction. That is what the whole bone marrow is going into destruction. That is a syphilitic in nature. The thalassemia is mostly because of the inherited conditions, and in that there is a beta chain is not making properly combinations of the hemoglobin, leading to the destructions, and that is called syphilitic in nature. So this is a syphilitic impairment at the level of hemoglobin. Thrombocytopenia generals. So this is what is the thrombocytopenia. Thrombocytopenia gives rise to a capillary leakage and there must be a bleeding. So mostly it is related to a syphilitic and it is mostly due to the reduced platelet count due to the failure of the megakaryocyte maturation. So it is again the bone marrow is affected. Most commonly occur in cases of a dengue. It is a physiological in nature and it is also found in some of the leukemia also. So there is a maturation arrest or maturations affected or failure. So in leukemia, the primary symptoms is the increase the WBC count and the primitive white cells are there from the bone marrow to increase and defending. So that is what psychotic in nature. But then again, it goes into destructive tendency. So it is a syphilitic. So leukemia can be syphilitic in nature. There are a different variant of the leukemia, the acute myeloid leukemia, acute lymphocyte leukemia, chronic myeloid leukemia, and chronic lymphoid leukemia. You can go through the pathology book and read further for this, but it is mostly a psychosyphilitic in nature. Hemophilia, it is a bleeding disorder. It gives rise to bleeders. So anywhere hemorrhage in the body is a syphilitic in nature. So this is what hemophilia is, syphilitic in nature. Polycythemia can be a compensatory mechanism to the psoric. So it is a physiological when the person living in the high altitudes. So it is because of lack of oxygenation, the body try to compensate with the more RBC production. That is the polycythemia. And the psychosis when the red cell count increase due to the tumorous conditions of the organ. So this is what again the polycythemia is the psychotic. Leukocytosis when any physiological defense is needed, the body is first try to produce the inflammations by increasing the leukocyte in the terms, which is soric in nature. But if it is gone out of control, then it is psychosis. So psychosis, again you have to understand the psychosis and SORA based on the defense mechanism of the leukocyte. So differential count is most important. So whenever we are understanding the inflammatory process, the first mediator with the inflammatory process is the neutrophil. So neutrophil comes into the play as the first primary defense of the body. So whenever you see the CBC report, the leukocytes is increasing, say around 15,000 or 20,000, and the neutrophil is more, then it is a primary inflammation, acute inflammation. It is purely a psoric in nature. But the same WBC count around the 15, 16,000, and you found that the lymphocyte is rising. That means the primary inflammation is not taken care, or primary inflammation is insufficient to defend. So it started with the secondary inflammations, and the lymphocytes play into the role, and that is called the chronic inflammation. So this is what you go from psoric to psychotic. This is psychotic. The chronic inflammation has been started. Psychosis. Down syndrome. So Down syndrome represent as a genetic trisomy. So there is an extra copy of the genes in the 21 number, 21 trisomy. So this is what presentations is psychosis. But due to this Down syndrome, there is a, affections at the level of the heart. There is a no development, a small hand, webs, and everything. So it gives rise to a distortion and destruction. So it is a psychosyphilitic in nature at the genetic level. So we have a certain neurological disorders. The neurological disorders like the acute confusional state mostly due to the drugs are the psorics or sometimes due to the change in the biochemistry for a particular a temporary and for a time being is a psoric in nature. If this confusion state due to the endocrine disturbances are due to mostly due to the increase or decrease in the hormonal level or a destruction of the hormonal level is psychosis or maybe a syphilitic in nature. So nutritional disorders are purely a soric due to the organ system failures or the psychotic syphilitic like a hepatic failure. So mostly the confusional state due to the nutritional disorders. So for example, hypoglycemia, that is a purely a soric in nature. Whereas due to the organ failure, that means the patient goes into acute confusional state or a coma due to the hepatic failure or a uremia or due to some bacterial meningitis are sorosyphilitic in nature. Or sometimes the patient goes into due to the coma into tubercular meningitis, it may be a sorocyto or syphilitic or sometime due to the vascular or the hypertensive encephalopathy, mostly it is psychotic in nature. Or sometimes patient may end up with the subarachnoid hemorrhage, it is psychosyphilitic in nature. Epilepsy due to febrile convulsion, as we have discussed earlier, that is what epilepsy due to the febrile convulsion. It is an increase in temperature leading to a development of the change in the electrical potentials at the level of brain, which is expressed outside on the muscles and produce the epilepsy. So it is a purely a soric in nature due to the febrile convulsions. Epilepsy after a trauma, it can be a sorosyphilitic or after a stroke is a syphilitic or sometimes the tumor epilepsy due to the space occupying lesions in the brain, it is mostly a psychotic. Epilepsy due to meningitis is soric, but epilepsy goes into a status epilepticus, that is a psychosyphilitic in nature. Another neurological condition is called as a dementia or amnestic syndrome. It is a loss of memory. So, if it is due to some idiopathic degeneration, mostly it is happen in the old age, or we call it as a newer name. We call it as a Alzheimer's disease. So, this is what the syphilitic in nature. Due to neoplastic disorders, for example, there is a tumor in the brain and the person goes into, or some benign tumor in the brain and the person goes into loss of memory, it is psychotic in nature. Or due to the malignant tumor, it is called as the astrocytoma, it is psychosyphilitic in nature. Dementia may be due to certain infections or the soric, due to some metabolic disorders, which we called as psychosis or syphilitic. Disorders of the vision, so the mononuclear disorders like a cataract or a syphilitic, glaucoma or psychosis. Mostly cataract is psychosyphilitic in nature because the cloudiness and haziness lead to the distractions. Glaucoma, there is an increased pressure in the eyes, is the psychotic. The vitreal hemorrhage are the syphilitic. Retinal detachment are the syphilitic in nature. So disorders or the ocular motility, like a weakness of the movement, is psychosis, and the loss of movement is syphilitic. So this is what you have to understand. The patient is presented to you in which state. Thus, all disease due to inflammations, infections. This is what we have to understand in our proper perspective, that all disease are due to inflammation, infections, or nutritional disorders are the soric. All these are due to space occupying lesions or atherosclerosis or underexpression of neurotransmitter is psychosis, and all disease due to the destructive disorders are the syphilitic in nature. So this is what our conclusions of the day. So each and every patient present to you with just the name of the disease, you need to understand which process is going on inside the patient system. You need to find out what is there. Is this person is defending in a soric way? Is this person is defending in a psychotic way? Or is this person is defending in a syphilitic way? Again, the miasm and certain psychiatric disorders. So, sir has given the idea about how psychiatric disorders is there. So soric ailments are the disorders which are due to the deficiency and have purely physiological tone. So neurotic disorders such as the anxiety neurosis, the restlessness, the simple depressions, the melancholia, sadness, hypochondriasis that have no pathological or structural changes involved are the soric ailment. Psychotic ailments are those which are produced due to the space-occupying lesion or due to some metabolic disorders like the uremia, bilirubin imbalance, hepatic encephalopathy, hypochondriasis, phobias, and imbecilities. Here, the salient features are some kind of the stasis, slowness, pseudoisms, and the cover-up. So this is what the presentations of the neuropsychiatry in these terms. Whereas the syphilitic ailment, this is mostly due to disorder due to some kind of the distortions or perversions like mania, OCDs, schizophrenia, psychosis, hysteria, paranoia, or mental retardations. So this is what you have to understand, that is syphilitic in nature. Down syndrome, psychosyphilitic, idiocy, perverted sexuality, all are syphilitic in nature. So this is what you have to. So there is a total loss of control over the thoughts and emotions in this element, making them belong to the syphilitic miasm. So the key phase is the out of control. So whenever you find anything which is out of control is syphilitic in nature. So this is what the everything which we have divided into the miasmatic process. Now we have to understand the man with the perspective of the dominance of the brain. So whenever we are considering the dominance of the brain, this will help you to identify the person is defending either a right-sided or person is defending in the left-sided. If we know this process, then our selections of the medicines is become very easy. So we all are governed with the two brain hemisphere, and that brain hemisphere giving rise to a certain functions, and according to that functions there is a genetic certain characteristics. So if we found that the person is defending right sided and their characteristic is not matching with the right left brain dominancy, so this is what you have to match the persons, and then your medicine become very easy to prescribe. So this is what sir has given the idea about the brain dominance. So we all know that the brain has the two sides, the right side and the left side, and there is a crossover connection. So we all know that the right brain controls the left side of the body, whereas the left brain controls the right side of the body. So if the person is left brain dominant, don't confuse yourself. Understand that the right side is the working side, it is a hand and legs. So that is what the effect. Whereas the brain dominance means the left side, this is the dominant part of the brain, it is a controller system. So one is the controller system and one is the effectors. So the controller system is governing something and effect on some other parts. So this is what you have to, don't confuse yourself with the right and brain, left brain, but sometimes it happens. In the initial time, we are being confused with the process that the right brain, right side, left brain, left side. This is not like that. So left brain dominant people. That means the left brain controls are known to have a following characteristics. So left brain has the following characteristic like logical, analytical, work oriented, result oriented, positive, mathematic calculations. They are more money minded, more calculative, language interested, and the achiever. So these are the things that the left brain dominant. So left brain control right sided. So those people who are defending right sided, they have this quality. So left brain dominant people are good at a business. See, if the person having a logical quality, the person having an analytical quality, the work oriented, visual oriented, very mathematic calculative or money minded. So what are the people's quality? The left brain dominant people can be a businessman, a good management, MBA, the executive, the supervisors or the traders, engineers, electrical engineers, computer engineers, the mathematicians, the leader, the radiologist, the pathologist, the physiotherapist, tourist, and the traveler. So these all are the process in the left brain dominant people. Now, right brain dominant people, that is also known as following attribute. So right brain control left side of the body. Okay, so right brain dominant peoples having a emotional, the imaginative, the sensitive, the sentimental, creative, the artistic. poetic, spiritualistic, and the historical attitudes. So they are artists, painters, poets, musicians, dancers, planners, architects, scientists, computer graphics, commercial artists, doctors, lawyers. Doctors and lawyers have to be a both brain dominant because of predominance of the logics and imaginations. Very interestingly, it has been observed that the people who have particular type of nature have an affinity to have affections on the same side. For example, the strong, positive, logically oriented people or the constitutions tend to suffer from the right-sided affection. That is, means the persons who are a left brain dominant, they tend to suffer from the right side affection, showing the immune impairment more on the right side. This is the calculation. If the person is very meek and sensitive and creative, tend to suffer from the left-sided affection because it is controlled by the right brain dominant. So the sensitive peoples are the right brain dominant. It has been seen in our repertories and materials that the right-sided remedy have more metals and positive remedy, and the sensitive and the historical remedies are given more on the left-sided affection. So this is what our materia medica also tells about the mathematical calculation. So what the remedy comes into this? So we have a right-sided remedy. So most of the metals are the right-sided remedy, like alumina, argentum, aurum, manganese, mercury, palladium, platina, stainless. Platina can be a left-sided remedy also. The most positive remedies are all are right-sided, like the arsenic, camphor, causticum, heparin, luxvomica, mercury, sepia. Most money-minded remedy like arsenic, bromia, calcarea, lyco, pulsatilla, sulfur, all are right-sided remedy. So left-sided remedy, the most left-sided remedy are the sensitive and the historical remedies. So we have argentum nitricum, asafoetida, capsicum, senna, clematis, coccus, graphitis, creosote, latex, miserium, phosphorus, sepia, and sulfur. We have oversensitive metals like cuprum, stannum, platinum, zinc, and ferrum. All these metals are left-sided. Historical remedies like the Ignatia, Valeriana, Viola odorata, Semicifuga, cyclamen, all are left-sided. The mental characteristic of a Sora, which stands for sensitivity, matches the right brain dominance. So this is what you have to understand, that the first development is the right brain. Then right brain learns something and it connect to the left brain. So left brain make everything analyze and store into the brain. So that is what the first learning brain is, the right brain, then the left brain. So the mental characteristic of the Sora, which stand for the sensitivity, matches the right brain dominance. Hysterical and sensitivity, imaginations, illusions, delusions, fantasies, and out of control symptoms, which are more of the syphilitic and could be a right brain dominant and hence the left sided. So when the person goes into imagination, they having a illusion, delusion, fantasies, and hysterical presentations out of control, which is syphilitic in nature, and it is a right brain dominant. And so the right brain dominant effect is on left side of the body. The second, the logic, the planning, and the manipulative brain is of a psychosis. So the when the first is the Sora. Sora is the right brain dominance, and then goes into a process called as a logic, planning, manipulation is a psychosis. It's a psychotic, it's a second brain. So that second brain is the psychosis, maybe give rise to more right-sided affections. This is what the left brain is controlling. But as the creativity increase in the psychosis, so creativity goes increasing again, it shifted from the left to right. Psychosis, the left side become more prone. Similarly, when the syphilitic attitudes or the soric trait is more on the working or industrial size, the constitution is more on right-sided prone. In short, the constitution which are full of work and thrust can be more of right-sided. In short, the constitution which are more of sensitive and spiritual can be of left-sided. Do not confuse yourself. The constitution is workaholic and everything. It is right-sided because of industriousness, business attitudes, and calculation and everything. And the constitution, right-sided means the right half of the body controlled by the left brain. Left-sided means the left half of the body controlled by the right brain. So this is what you have to understand. Again, warning is given by the sir that these are only some hint which is helpful as a pointer to the group of remedy and to understand the relationship between the miasm and the remedy. So this is what you have to understand. So this is what very important. One should not take this ain't as hard and fast rule. There are some exceptions are there in these rules also. So this is what sir has given warning that this is something that you have to understand. So in simple term, brain dominance, left brain control the right side of the body, right brain control the left side of the body. So right brain is the initial brain, it is a learning brain, so it is a sora. And when it goes out of control, again the right brain become a syphilitic. So in syphilis, you can find out the left-sided affection is more. This is one tips. Okay. Then after learning, they become a more logical, more calculative. So left brain is working more and it is called a logical brain. So the affection most go toward the right sided. So most of the psychotic disorders are right sided affection, but it is not the hard and fast rule. Keep in mind, it is something you have to very precise. So sometimes you can get the left sided affections with the psychotic pathology, that is psychosis. Then and then your remedy of the selections is changes. So this is what very important. So this side is important for understanding of our miasm as well as the group of remedy to be prescribed on this. So hope we conclude our today's sessions here. As we have a genetic of psychosis and the genetics of the cancers, we will start from tomorrow and mostly we will conclude day after tomorrow the sessions of these books. So, is there any questions regarding this? See, I had share a question answer sessions link through Google form. So, if you have any questions regarding the homeopathy and everything, so you can put it into that Google form. So we will have a next Sunday. We will have a session on that, and that session will help us to understand the process. Hypochondriasis, soric or psychosis. Hypochondriasis is soric, as mentioned by the sir, because there is only a functional changes, no structural is involved. So if there is a structural changes is involved, then it goes into a psychosis, a constructive psychosis because of fear, but it is mostly a soric in nature. SOL in the right side of the brain leading to the paralysis of the left side. What to consider? What to consider? Ask yourself the question. There is no crossover connections below the bones and medulla. In the cerebrum and cerebellum, there is a crossover connection. So whenever you are considering the cerebrum and cerebellum, the effect should be considered to be a first because the effect will give you the prone affinity of that particular person. Even though there is a right-sided affection, but the effect is seen on the left-sided, so you need to choose the remedy which is acting on the left side of the body. Hope you got your answer. It is not the side related to SOL. It is the effect related to that. See, handedness is given by the hammer for the particular purpose of finding out the history from the patients and the case taking purpose. This not change the brain dominance, as I have not seen. Okay, again I need to read for that, but this is not things which I have not seen. But handedness help us to understand that it is mostly related to the history taking, and in history taking you need to find out that if the person is left-handed and having a right-sided affection, so the this right-sided affections is mostly associated with the business partner and outside, but in a right-handed person. But if the person is left-handed, then the conflict is reversed to the that, and in reverse there is a family, mother, there is a children's and everything. So for your purpose of case taking, you need to ask this, and that will help you. But I don't think that the right brain dominance or left brain dominance has been changed due to the handedness. Okay, I need to read more further, Dr. Priyul, so I will give you this answer later on. But as per my understanding and knowledge, handedness cannot change the brain dominance. A disease like thrombocytopenia, purpura, or the autoimmune platelets are less. What rubric can be considered? There is one rubric is given in the book, Complete Dynamics Repertory, Whirl of Disease. WERLF. It is a pathological rubric specifically associated with this uh, thrombocytopenia. Okay, but you need to find out what is the reason behind the thrombocytopenia. The functions of the platelet is something that to either to stop the bleeding. Functions of the platelet to stop the bleeding. Platelet is aggregating for the purpose of stopping the bleeding. Now the things that what happens, the thrombocytopenia means what, the platelet has been reducing. So if platelet is more, so blood become more thick. So blood become more thick, that is what the process. So the reversal to that is mostly the thrombocytopenia happen because of either a bone marrow depression. So you can directly take one rubric, bone marrow complaint general, as a thrombocytopenia is affected, or sometime you can take that is due to thrombocytopenia, if there is ecchymosis or hemorrhage, so you can take that hemorrhage tendency, actual blood thick. It is a reversal process. The blood is thick, that's why body is defending in the form of reducing the thrombocytes. Are you understanding? Yes, delusion injury will receive. This is one of the process, and helplessness. Both can be there. But blood is thick, that means the person is why I need to become more blood thick, because I don't allow to go into stage of hemorrhage, so I have to put this. So this is what you have to understand in the reverse process. Okay, so in thrombocytopenia you can take a hemorrhage, actual tendency, blood thick. Or one of the disease rubric which I have prescribed is, the point is world of disease, incomplete dynamics. Don't take directly that delusion injury will receive. You need to find out something from the patients, and then you can put into consideration. This is the questions of mind of pathology. Whenever you didn't find anything out of the patients, then you go to the mind of pathology and prescribe. Unless and until the patient is giving you PQRS, go with the PQRS. Sometimes you don't consider any mind of pathology and PQRS, you getting the PQRS and you prescribe on the basis of PQRS, the patient will be better. Patient will be no normal. So this is what very important in this. Yes, defend, support by aggregating, yes, when the clothing is hampered. Yes, absolutely. Great. So hope you all having a great sessions. And we have a question answer sessions on the next Sunday. So keep your question to put on this Google form. So I will make a presentation on that and will answer most of your queries and question in that question answer session. So that will help you to correct yourself, and also that I can learn from all of you also. A right-sided means what? Business, family, partner, business, partners, in-laws, if it is a female, or the spouse. To ask about something where he was gone out of control, where he was gone helpless to develop this paralysis. Paralysis means the helplessness conditions of the body. So thank you so much. Have a great day. Thank you. Thank you all.